In August 2004, 164 people from across the Atlantic provinces, Canada, and the U.S. gathered in Charlottetown, Prince Edward Island, for the Atlantic Summer Institute on Healthy and Safe Communities. They came to share knowledge, meet like-minded people, plan projects, and work collaboratively to create healthier, safer communities in Atlantic Canada. The Institute was supported by the National Crime Prevention Strategy, as well as other federal and regional partners. Because it was a merging of diverse sectors, it was an opportunity to explore the many faces of health and safety in Atlantic Canada.
To me, it's communities working together from all different sectors, coming together to brainstorm on how to build on initiatives or create initiatives to address the need or problem.
Perfect.
I would echo that. Absolutely echo. Completely.
And valuing the diversity and recognizing different people's capacities and capabilities and valuing that as part of the collaborative force to improve the health.
The flock, this is a crowd, the flock that came over from St. John's, Newfoundland, and we are part of the Wellness Coalition, and we are so happy to be here. A lot of things come to mind, but probably the strongest thought I have is around inclusion. Inclusive opportunity for people to participate, and for them to feel that they have a choice, so that the opportunity for people to know that they have a right to be involved, that they have a right to feel safe, they have a right to be part of a community and to be included in determining how that community participates, how people are supported, and how people are cared for.
It is a lot about choice, I believe, but also fundamentally for me it's about respect, respecting self and others and respecting the voice of the community. And just that, around respect, I think a lot of issues come out of not respecting self and others, the bullying, the violence issues, and a lot more that lead down that road.
I think a lot of it too involves people being able to meet their basic needs so that they can fully participate in society. So the poverty reduction, I think, is a real key piece.
By getting our community safe, we have to approach our work in a different way, and that is that we are not the people who can make the change. The power has to come from the people and the public themselves, and somehow we have to work differently for that to happen.
Well, I work for the Department of Indian Affairs, so we deal with a lot of First Nations. So after the first session, I'm trying to find out a way of how we can assist First Nations in developing policies in those areas and how to apply them, and just help in any way that we can.
I guess if I look at what health means to me as a staff member at 4 Neighborhoods, it means as a community health center, our place of work, providing a supportive, informational, socially reactive place where people can come and learn and be a part of their community and be supported and share knowledge and grow individually as a community by being together.
It means overall a healthier community where we have participation, we have willingness, and people taking on responsibility for their health.
And it's funny because I was just listening to the radio on my way up here and speaking not about this conference, about how safety is an issue on campuses now. For example, crimes such as theft or violence or rape are issues in Canadian universities. So I think crime or violence is an issue everywhere. And when we think of community, I think we can think of community in different areas.
Right, yeah.
Because you usually think of community as a city, a village, but there are smaller units that have their own community set up. So if we want healthy populations in our communities, I think we have to look at the variety of communities that we have.
I guess when you ask me that question, what does health and safety mean to me in my line of work, I think of the rising crime rate in Eastern Canada, and I think of the use of prescription drugs or the misuse and abuse of prescription drugs such as OxyContin, and it makes me wonder, I guess from the health side, how we prescribe these medications and how they're used, and the link between illicit drug use and break and enters. So that's what came to my mind.
Because there's a lot of phone calls and letters coming in to seniors, and there's a lot of them that are telling us that they get asked for money. And also, when they go to the bank, like they're worried about using bank machines because they've heard that once or twice it's happened that people got taken. And there's a lot going on in that area that I find, like my mom is 81 and she's at home and she tells me she gets 5-6 calls a day from people requesting money for charities that she doesn't know very much about, so obviously there's a fair amount of that going on. Of course there's other things, like a senior walking in a mall can get her purse snatched so bad, so it's related to crime, a lot of it really.
Well, health and safety, what comes to mind? Well, I think for me, certainly I'm a police officer in the United States, and I think one of the things that's key for me is going to be how communities can stay safe, and I mean that really in the very basic way of being free from any kind of criminal activity affecting them either directly or indirectly. And I think for most people in the United States, particularly people who live in the urban areas, what affects them most is not necessarily criminal activity, but the threat or the fear of it. And therefore, part of my role should be to diminish as much as I can that level of fear so that people stay safer. I think they're going to live longer, they're going to live better. As Dennis was mentioning this morning, I think the world's going to be a better place with as much as I can do to reduce the level of crime and people's perception that it's out there about ready to get them.
Injury prevention is a major issue here on our province, but it's also a major issue in Atlantic Canada. I don't have the figures with me for Atlantic Canada, but it is mind-boggling what it's costing us for unintended injuries. Car accidents are high, but falls are very, very high. Car accidents kill, falls injure, and leave people with disabilities. We have an aging population. We have to try to help our seniors remain healthy and fall-free. And we also have a program looking at assisting seniors with home safety, home and personal safety.
Health and safety in our communities, in schools, which is the area that I work, are really important. They're interconnected for sure. We're doing a lot of work on anti-bullying, anti-violence programs, personal relationship. At the same time, we're doing a lot of work with health promotion, healthy eating, active living, those kinds of things, and they dovetail really nicely. And they're certainly one of our major areas of emphasis as we move into the new school year and certainly for the next foreseeable future.
I think that like it's a lot of work that need to be done, and I think that really the people that give social services or serve the community really need to make good policies that need to be really implemented, because I think a lot of things that are in place, but I think our heart is in the right place, but we really need to be serious about what we do and really try to help those that are in need. And I just think that pretty much we need to be real and really get the job done and stop doing a lot of talk and just actually implement policies, pretty much a lot of them that's already in place. And I think that would help out. And the piece about health is a major factor. We can get more policemen, more cops. It's not going to really reduce the problems. We actually got to get to those root causes, and that's poverty. And then that way we could have good, sustainable neighborhoods.
As it relates to, very quickly, to the presentation that Dennis just gave, and for us as delegates, it can't be considered one unto the other. I mean, it's an integrated concept. You can't have public safety without public health. You can't have good, healthy communities without good public policy. So it's not to be treated as separate ideas. I think it's to be treated as, all the quality of life initiatives and all the importance of investing in social capital. That's really that is the true end. Dennis is right in his presentation that if we don't do that and we keep operating in silos, that we probably won't see the results.
I think if anything, conferences like this show how interconnected everything is. It's not just a question of public safety or a question of health. It's related to income, it's related to choices, it's related to fairness and justice. So it's a neat place to be when you're with people that buy into the message and that understand that it is a complex mosaic of issues, and there's not one button to push or one lever to pull.
The 2004 Atlantic Summer Institute on Healthy and Safe Communities provided a unique opportunity for researchers, policy developers, practitioners, and community leaders from crime prevention, health promotion, injury prevention, and social development sectors to join together in groundbreaking work and enjoy a taste of PEI summer.